Good day everyone, I am Emmanuelle D. MPig, and today our group will be discussing and reporting about understanding women's health, particularly the common health problems and concerns among women. Now, some of you might wonder, why do we need to separate the discussion between men's health and women's health? After all, pare-pareho lang naman tayong tao. We all have the same major organs, the same body systems, and the same basic human needs. So bakit nga ba kailangan pa siyang ihiwalay? Well, the answer is that men and women do not experience health in exactly the same way. So although we share many similarities, our body structures, hormones, reproductive functions, and even physiological processes are all different. And these differences, they greatly affects kung paano nagde-develop yung body natin, kung paano nagpa-function, and even how certain diseases affects us. Now, for women, they have unique reproductive organs and hormonal processes that plays a major role in their overall health. So, throughout life, nakaka-experience po yung mga babae ng many natural changes, such as puberty, menstruation, which happens every month, pregnancy, childbirth, menopause, and of course, aging. So although these are all normal stages in a woman's life, they also bring physical, emotional, mental, and hormonal changes. And these hormonal changes can also influence mood, metabolism, the reproductive health, and even the increased susceptibility or vulnerability to a certain disease and condition. So this is one of the reasons why some health problems are more commonly experienced by women compared to men, and vice versa. Aside from hormones, there are also other factors that can affect women's health. This includes genetics or family history, the lifestyle, diet, yung stress, environmental influences, and of course the access to healthcare. So all of these factors can contribute to the development of certain diseases and health conditions. This is why understanding women's health is very important. By increasing awareness and knowledge, we can help promote prevention, early detection, proper treatment, and healthier lifestyles. This also helps women to become more aware of their bodies and the changes that may happen throughout different stages of life. So to dive deeper into the women's health, let us now proceed to the common health problems that affects women. These are the reproductive conditions among women.
So, good day everyone. Now, I will be discussing polycystic ovary syndrome or PCOS, which is now known as polyinducing metabolic ovarian syndrome or PMOS. So, PMOS is a more updated term because it better reflects the condition's complex nature, involving not only the ovaries but also multiple endocrine and metabolic disturbances. So, PMOS is a common hormonal and metabolic disorders affecting women of the reproductive age. So, it is characterized by irregular or absent ovulation, elevated androgen levels, and polycystic ovaries. Beyond reproductive concerns, PMOS significantly affect metabolic health, increasing the risk for insulin resistance, type 2 diabetes, cardiovascular disease, and infertility. So now, for the causes and signs and symptoms of PMOS, so the exact cause of PMOS remains unclear, but it is believed to result from multiple interacting factors. So genetic predisposition plays a major role, especially in women with family histories of diabetes or hormonal disorder. Insulin resistance is a key feature, where the body cells do not respond properly to insulin, causing increased insulin levels that stimulate androgen production. Hormonal imbalances, obesity, sedentary lifestyle, and chronic low-grade inflammation further contribute to the syndrome. So clinically, PMOS presents with irregular or absent menstruation, infertility, hirsutism or excessive hair growth, acne, scalp hair thinning, weight gain, and dark skin patches known as acanthosis nigricans. Enlarged ovaries with multiple small follicles may also be detected on ultrasound, so these symptoms reflect both reproductive and metabolic dysfunctions. So now for the treatment and prevention of PMOS or PCOS, the management of PMOS focuses on symptoms control, improving metabolic health, and achieving reproductive goals. Lifestyle modification remains the cornerstone of treatment. Weight loss through proper diet and regular exercise can improve insulin sensitivity, restore ovulation, and reduce complication. Pharmacologic treatments may include oral contraceptives to regulate menstrual cycles, metformin to address insulin resistance, and anti-androgens to reduce symptoms such as hirsutism and acne. For women desiring pregnancy, ovulation induction therapies or assisted reproductive technologies may be necessary. Although there is no definitive prevention for PMOS or PCOS, early recognition and risk reduction are essentials. Maintaining a healthy weight, regular exercise, routine screening, and early intervention for menstrual irregularities can reduce long-term complications. Understanding PMOS or PCOS as a broader endocrine metabolic disorder emphasizes the need for comprehensive, multidisciplinary management. So now for the nursing management. So as a nurse, our role focuses on health promotion, symptoms management, emotional support, prevention of complications, and improving the patient's quality of life. So first, we have here the health education. So nurses should provide comprehensive health education. So we teach the patient about the PMOS, including its hormonal imbalance, metabolic effects, and possible long-term complications. So patients should understand that PMOS or PCOS is a chronic condition that requires continuous management and follow-up care. We also educate the patients regarding the importance of medication adherence, regular consultations, laboratory monitoring, and healthy lifestyle practices. Nurses should explain common symptoms such as irregular menstruation, acne, hirsutism, infertility, and weight gain to help patients better understand their condition. So the second one is lifestyle counseling. So lifestyle modification is considered one of the primary intervention for PMOS management. Nurses encourages patients to maintain a balanced diet that is in low sugar and refined carbohydrates to help improve insulin sensitivity. We also promote regular physical activity because exercise can help reduce weight gain, regulate menstruation, and lower metabolic risk. Additionally, nurses should counsel patients about the adequate sleep, stress management, and avoidance of smoking and alcohol because these factors may worsen hormonal imbalance and metabolic complications. And for the third one, psychosocial support. So PMOS can significantly affect a patient's emotional and psychological well-being. Many patients experience low self-esteem due to acne, excessive hair growth, obesity, or fertility problems. As a nurses, we provide emotional support and therapeutic communication. We also encourage patients to verbalize their feelings and concerns. Nurses should also assess for signs of anxiety, depression, social withdrawal, or body image disturbances. Another responsibility is involving family members or support system when appropriate and referring patients to counseling or support groups if needed. So the fourth one is monitoring. Continuous monitoring is essential in managing PMOS. Nurses monitor menstrual patterns, weight changes, blood pressure, blood glucose levels, and other symptom changes. We also assess for metabolic complications such as diabetes mellitus, hypertension, dyslipidemia, and cardiovascular problems since PMOS is strongly associated with metabolic syndrome. Nurses are also responsible for documenting patient progress, monitoring laboratory results, and identifying early signs of complication to ensure timely interventions. So the next one is medication management. Medication management is another important nursing responsibility. Nurses educate patients on the proper use of prescribed medication such as hormonal contraceptives, anti-androgens, ovulation-inducing agents, and insulin-sensitizing medication like metformin. We monitor for therapeutic effects and possible side effects, including gastrointestinal upset, hypoglycemia, or hormonal side effects. Nurses should also encourage patients not to abruptly discontinue medication without consulting their healthcare provider. So for the last management, we have the referral and collaborative care. So nurses play an important role in referral and interdisciplinary collaboration. Patients may need referral to an OB/GYN, endocrinologist, fertility specialist, dietitian, dermatologist, or mental health professional depending on their symptoms and complications. Nurses coordinate care among healthcare providers to ensure holistic and patient-centered management. We also advocate for regular screenings and follow-up appointments to help prevent long-term complications associated with PMOS or PCOS. Thank you.
Hello everyone, today we are discussing endometriosis, which is the chronic gynecology condition where tissue similar to the endometrium, the lining of the uterus, that grows outside the uterus and commonly affecting the ovaries, fallopian tubes, and pelvic lining. To explain this clearly, even though this tissue is displayed outside the uterine cavity, it still behaves exactly like a normal uterine lining. So this tissue still responds to hormonal changes, meaning they thicken, break down, and bleed every single month with the menstrual cycle. However, unlike a normal period where blood flows out of the body, this trapped blood has nowhere to go, leading directly to inflammation, tissue scarring, and severe pain. Statistically, this is a very common condition that affects about 1 in 10 females worldwide. Healthcare providers most often diagnose it in a people in their 20s and 30s. While it is a lifelong chronic condition, the symptoms of endometriosis are often manageable with treatment. Moving on to where this tissue implants and why it occurs, the most common places you can develop endometriosis include the space behind your uterus, the myometrium, which is a layer of your uterine wall, the ovaries, the peritoneum, and the fallopian tubes. The exact cause is unknown, but several factors increase risk. A leading theory is retrograde menstruation, which is the backflow of the menstrual blood into the pelvis instead of exiting through the cervix. Other major risk factors include a family history, indicating a genetic predisposition, an early menarche or short menstrual cycles, heavy or prolonged menstruation, immune system dysfunction, and delayed pregnancy or infertility. Next is the prevention, screening, and diagnosis. So, when looking at the preventive care and clinical diagnosis, there is no definite prevention for endometriosis. However, a patient risk may be reduced by using hormonal contraceptives to regulate menstruation, as well as maintaining a healthy lifestyle to reduce systemic inflammation. For screening and diagnosis, it is important to know that there is no routine screening test like a pap smear or standard blood test available for this condition. Instead, it is diagnosed through a clinical workup involving a pelvic exam, an ultrasound to visualize deep tissue masses or cysts, and finally, the absolute gold standard, a definitive diagnosis via laparoscopy, which is a minor surgical procedure where a surgeon can physically see and biopsy the tissue. Next is the comprehensive nursing management. So as a nurses, our management is multidimensional, combining physiological intervention with psychological supports. First and foremost, we must assess pain and give prescribed analgesic, such as the non-steroidal anti-inflammatory drugs, to block inflammatory pathways. We can also apply warm compress to relax pelvic muscle and offer immediate physical comfort. Second, we must meticulously monitor symptoms, keeping a close eye on the patient's menstrual cycle patterns, bleeding volume, and pain triggers. Third, we must administer medication, particularly hormonal therapy, that aim at suppressing ovulation and lowering estrogen levels, while carefully watching for side effects like hot flashes or mood alterations. Beyond medication, we actively promote rest and comfort, provide emotional support to reduce stress, which is vital since chronic pelvic pain is deeply linked to anxiety and depression, and educate the patient about the disease, its treatments, and critical warning signs of when to seek emergency help. Finally, we encourage a healthy lifestyle through diet and low-impact exercise to optimize long-term health and mitigate systemic inflammation.
Good day everyone, I am JILLIAN GALVEZ and today I will be discussing to you Uterine fibroids, a common reproductive and gynecology condition that affects many women during their reproductive years. This topic is important because although fibroids are usually non-cancerous, they can still cause significant health concerns depending on their size, number, and location. Some women may not experience any symptoms at all, while others may have heavy bleeding, pain, or pressure symptoms that affects their daily lives. Understanding uterine fibroids helps us identify risk factors early, recognize symptoms, and promote better awareness of women's reproductive health. And uterine fibroids are non-cancerous growths that develop in the muscular wall of the uterus. They are also called leiomyomas. These growths are made of smooth muscle cells and connective tissues. Fibroids can vary wildly in size, number, and the location. Some may be very small and not noticeable, while others can grow large enough to change the shape of the uterus. They may be found inside the uterine wall or the intramural, inside the uterine cavity or the submucosal, or on the outer surface of the uterus or the subserosal. Fibroids are influenced by hormones estrogen and progesterone, which is why they usually develop during reproductive years when hormone levels are active. Causes and risk factors of uterine fibroids. The exact cause of uterine fibroids is not fully known, but several factors are linked to their development. One major factor is hormonal imbalance, particularly high levels of estrogen and progesterone, which can stimulate the growth of fibroids. Genetics also play an important role, as a women with a family history of fibroids are more likely to develop them. Age is another risk factor, with fibroids being more common in women between 30 and 50 years old due to prolonged hormone exposure. Obesity increases the risk because fat tissue produces additional estrogen in the body. Early onset menstruation also increases risk since it leads to longer lifetime exposure to estrogen, and women who have never been pregnant may also have a higher risk, possibly due to less hormonal changes during pregnancy. In addition, diet and lifestyle factors such as high red meat consumption and low intake of food such as fruits and vegetables may contribute to increased risk. Many women with uterine fibroids do not experience any symptoms, especially if the fibroids are small or located in areas that do not affect the surrounding organs. However, when symptoms do occur, they depend on the size, number, and the location of the fibroids. And one of the most common symptoms is heavy or prolonged menstrual bleeding, which may also be accompanied by painful periods. Some women may experience pelvic pressure or a feeling of fullness in the lower abdomen due to the size of the fibroids. If the fibroids press on nearby organs, they can cause frequent urination or difficulty emptying the bladder, as well as constipation when intestines are affected. In some cases, the abdomen may appear enlarged, and there may also be a lower back pain or pain during sexual intercourse due to pressure in the pelvic area. Now let's talk about the different treatments for uterine fibroids. The type of treatments depend on how big the fibroids are, the symptoms they cause, and the patient's future plans such as pregnancy. Note that not all fibroids need an immediate treatment. For our first treatment, we have here watchful waiting. This is recommended if the fibroids cause little to no symptoms, and in this treatment, the doctor simply monitors the fibroids through regular checkups, and no treatment is given unless the symptoms worsen. Next is medications. Medicines are used to control symptoms like heavy bleeding and pain. Hormonal treatments such as birth control pills, hormonal IUDs, or GnRH agonists help regulate hormones and may temporarily shrink the fibroids. Other medications like NSAIDs and tranexamic acid also helps reduce pain and heavy bleeding. Tranexamic acid is a common medication used to treat heavy bleeding. Next, we have here non-invasive procedure treat fibroids without surgery. One example is MRI guided focus ultrasound, which uses sound waves to destroy the fibroid tissue without making any cuts, allowing a faster recovery. Next is the minimally invasive procedure. It involves small incision or special techniques. This includes uterine artery embolization, radiofrequency ablation, and myomectomy done through laparoscopy or hysteroscopy. In this procedure, it shrinks or removes fibroids while preserving the uterus whenever possible. And lastly, we have the surgical treatment. It is used for severe cases. Myomectomy removes the fibroids but keeps the uterus, while the hysterectomy removes the entire uterus and is a permanent solution. In summary, for the treatment for uterine fibroids, treatment is chosen based on the patient's symptoms, needs, and overall health. Prevention and screening of uterine fibroids. Uterine fibroids cannot be fully prevented because they are influenced by hormones, genetics, and age, which are factors we cannot completely control. However, the risk of developing fibroids or their growth can be reduced by maintaining a healthy lifestyle. This includes keeping a healthy body weight, eating a balanced diet rich in fruits and vegetables, and also exercising regularly. These healthy habits help regulate levels of estrogen, especially estrogen, which plays a major role in fibroid growth. Proper medical guidance in managing hormonal balance may also help prevent fibroids from becoming larger or more severe. For early detection, regular pelvic examinations are important because they allow healthcare providers to feel changes in the size or the shape of the uterus. An ultrasound is also commonly used to confirm the presence of fibroids as it clearly shows the uterus and any abnormal growth. In some cases, an MRI may be used to provide more detailed information about the size, the number, and the location of fibroids. Early screening is important because it helps in planning proper treatment and preventing complications. In nursing management for patients with uterine fibroids, it focuses on careful assessment, symptom control, and patient support. Nurses closely monitor symptoms such as heavy menstrual bleeding, pelvic pain, and signs of anemia like fatigue, dizziness, or pale skin. Since excessive bleeding can lead to low iron levels, pain management is also an important part of care along with the administering of prescribed medications as ordered by the doctor or physician. Nurses also encourage patients to follow an iron-rich diet to help prevent or treat anemia caused by blood loss. In addition, nursing care includes patient education and emotional support to help patients understand their condition and treatment options. Nurses also play an important role in providing proper care before and after the medical procedures or surgeries, ensuring that the patient is physically and emotionally prepared. Overall, nursing management aims to improve patient comfort, prevent complications, and promote better health outcomes. That would be all for the uterine fibroids. Thank you.
Now let's proceed with cancers in women. First is the breast cancer. So breast cancer is one of the most common cancers among women, especially in the Philippines. So it is characterized by the abnormal and the uncontrolled growth of cells in the breast tissue. In simple terms po, nagkakaroon po ng sobrang daming cells sa breast na tuloy-tuloy lang yung paglaki and hindi normal yung pagdami. And because of this excessive growth, nabubuo po yung tumor or yung bukol sa breast which can sometimes be felt by the person. So this is one of the most common signs and symptoms of breast cancer, yung pagkakaroon ng bukol sa breast. This is why importante po na maging aware po tayo to whatever changes or unusual changes that happens into our body, especially to those na sensitive sa ating mga babae. As mentioned earlier, breast cancer remains the most common cancer among women in the Philippines. Actually, there are more than 33,000 new cases and around 11,000 deaths reported every year. Unfortunately, maraming babae na nadadiagnose only during the later stages of the disease, particularly stage 3 and 4, kung saan mas advanced na po yung cancer and mas mahirap na siyang agapan. So, these stages will be tackled later on during our discussion. So, there are many factors or maraming dahilan kung bakit late na-detect yung breast cancer. Of course, the one reason is often associated with limited access to routine screening, the lack of awareness, the fear of diagnosis, and even the common misconceptions about the disease. Because of this, it is very important that we are aware or that we raise awareness, because the earlier breast cancer is detected, the higher the chance of successful treatment and recovery. Ngayon naman po, let us talk about the two most common types of breast cancer. So, madami pa po itong types, but I only included those that are common and familiar na sa ating mga babae. So, the first one is called invasive ductal carcinoma or IDC. This is actually the most common type of breast cancer, accounting for about 70 to 80% of all breast cancer cases. Ang invasive ductal carcinoma po ay nagsisimula sa milk ducts ng breast. Yung milk ducts po are the small tubes na nagdadala ng milk papunta sa nipple. So you can see that on the picture naman po, nakalabel naman po dyan kung saan yung milk ducts. So kapag invasive na po siya, ibig sabihin, hindi lang siya nagsistay or nananatili sa ducts, kundi kumakalat na rin po siya sa surrounding breast tissues. The second type naman po is the invasive lobular carcinoma or the ILC. This type naman starts in the lobules, which are the milk-producing glands of the breast. Makikita rin po natin yan siya sa picture. Ito naman po yung part ng breast na responsible sa paggawa ng breast milk. Similar to IDC, invasive din po siya, meaning maaari rin siyang kumalat to nearby breast tissues. However, compared sa IDC, mas less common po ito because it only accounts for around 10 to 15% of breast cancer cases. In summary, the main difference between the two lang po is kung saan sila nagsisimula. IDC starts in the milk ducts, while ILC starts in the lobules or the milk-producing glands. Moving on to the stages of breast cancer. So, these stages help determine kung gaano kalala yung pagkalat ng cancer sa katawan natin. Usually, the higher the stage, the more advanced the cancer is. Starting with stage 0. This is considered the earliest stage of breast cancer. Dito, abnormal cells are only found sa milk ducts and hindi pa siya kumakalat sa nearby breast tissues. So, in this stage, very early pa siyang nade-detect, thus madali or mabilis din siyang maaagapan. Next is stage 1. In this stage, maliit pa lang yung bukol, which is usually up to 2 centimeters, and hindi pa siya gaanong kumakalat sa surrounding tissues of the breast. Compared to the later stages, mas mataas yung chance na maging successful yung treatment and recovery sa stage na ito. For stage 2, dito mas lumalaki na po yung tumor, usually around 2 to 5 centimeters, and possible na rin kumalat sa nearby tissues or lymph nodes. So dito, mas noticeable na talaga yung progression ng cancer. For the third stage, which is considered more advanced, so the tumor is usually larger than 5 centimeter na, and the cancer may have already spread to nearby lymph nodes and surrounding tissues such as yung skin or yung chest wall. So, mas severe na yung condition here compared sa earlier stages. And lastly, for the stage 4, which is the most advanced stage of breast cancer, in this stage naman, the cancer has already metastasized or nag-spread na talaga siya to distant organs of the body, such as yung lungs natin, the livers, the bones, and even the brain. So, kapag umabot na siya sa ganitong stage, mas complicated na yung treatment and management of the disease. So, overall, yung stages na ito shows how important early detection and regular screening are. Kasi the earlier breast cancer is diagnosed, mas mabilis po or mas madali po natin siyang maaagapan. For the signs and symptoms of breast cancer naman po, here are the following. A painless lump in the breast, bleeding or unusual discharge from the nipple, dimpled or puckered skin over the breast, persistent itch and rash around the nipple, pulled in or retracted nipple, and swollen and thickened skin over the breast. So kapag na-experience or na-feel nyo na po yung lahat ng sinabi ko kanina, kailangan na po nating magpatingin sa doktor. For the causes and risk factors, ano nga ba ang dahilan kung bakit nagkakaroon ng breast cancer ang isang babae? Now, the causes for breast cancer is actually unknown. However, these are some that may cause or may put you into a higher risk of having breast cancer. We have increasing age, especially for women over 40 years old. Early menstruation before 12 years of age. Late menopause after 55 years of age. Late childbirth or first pregnancy at an older age. Family history of breast cancer. Obesity and lack of physical activity. Alcohol consumption and smoking. Exposure to radiation, and hormonal changes or hormone replacement therapy. So, lahat po ng mga nabanggit sa taas are the risk factors kung bakit nai-increase yung susceptibility natin to having breast cancers. Now, let's talk about the method of diagnosis or the methods used to diagnose breast cancer. So, the first one is breast self-examination or BSE. So, ito po yung simpleng pag-check ng babae sa sarili niyang breast, which we can do even at home. So, through BSE, mas nagiging familiar po tayo sa normal na itsura at pakiramdam ng ating breast, which means mas madali po nating mapapansin if there are any unusual changes tulad ng bukol, ng pag-swell, or any changes sa skin of our breast. Although hindi po ito directly nako-confirm yung breast cancer, this could be a big help for early detection. Next is the mammogram. Ang mammogram naman is a special type of x-ray used to detect abnormalities or tumors in the breast. Kaya nitong makita kahit yung changes na hindi pa visible sa ating mata or wala pang symptoms. So this is highly recommended, especially for women age 40 years old and above, because mas mataas yung risk ng breast cancer habang tumatanda. Another method is the breast ultrasound. This procedure uses sound waves naman para makagawa ng images of the breast tissue. So nakakatulong siya to know if the lump is solid, or let's say solid mass, or fluid-filled cyst. So kapag solid mass, possible na it is cancerous. But if fluid-filled, usually non-cancerous siya. Lastly, we have the breast MRI or the magnetic resonance imaging. This method naman uses magnetic fields and radio waves para makagawa ng more detailed images of the breast. So sa ultrasound kanina, ginagamit niya sound waves. Dito naman sa MRI, radio waves. So these are usually used for high-risk patients or kapag kailangan pa ng further evaluation after other tests. So overall, the diagnostic methods are very important to detect breast cancer earlier. For the treatment of breast cancer naman, we have loco-regional and the systemic treatment. For the loco-regional treatment, dito naman is naka-focus siya sa breast area and sa nearby tissues affected by the cancer. The first one is the lumpectomy. So sa procedure na ito, only the tumor and a small portion of the surrounding tissues are removed. Next is the mastectomy or the mastectomy rather, which involves the removal of the whole breast. Usually, ginagawa siya kapag malala na or malaki na yung pag-spread ng cancer. Another procedure is the sentinel lymph node biopsy or the SLNB, which is done to check whether the cancer has already spread to the nearby lymph nodes or kung saan pa siya pwedeng mag-spread. And lastly, for the loco-regional treatment is the radiotherapy. It uses high energy radiation para ma-destroy yung cancer cells. So usually ginagawa ito after the surgery to kill the remaining cancer cells and reduce the risk of recurrence o yung pagbabalik nito. And for the systemic treatment naman, first we have the most common and most familiar sa ating lahat, which is the chemotherapy. So ginagamit po itong chemotherapy to destroy cancer cells with the use of strong drugs para rin po ma-stop yung pag-grow nila and pag-multiply. Next is the hormone therapy. So, some breast cancers grow because of hormones such as yung estrogen and progesterone nga po. So, hormone therapy works by blocking these hormones to help slow down or to stop cancer growth. And lastly is the targeted therapy. This treatment specifically targets certain proteins or substances involved in cancer growth. So, compared sa chemotherapy, mas specific yung target nito sa cancer cells. So, overall, these treatments all aim to remove, destroy, or control cancer cells and ma-improve yung chances ng patient for recovery and survival. To prevent breast cancer, here are the things we need to do. First is to maintain a healthy weight. Second, to exercise regularly and stay physically active. Third, to limit or avoid alcohol consumption. Fourth, to breastfeed when possible. So this is only applicable if you're a mother na. Fifth is to perform monthly breast self-examinations. So isa po yun siya sa na-mention at gidiscuss ko kanina sa methods of diagnosis. And then lastly, undergo regular breast screening and checkups. Moving on to the nursing management, the nurses should assess the patient's physical and emotional condition kasi hindi lang naman physical health yung naaapektuhan ng breast cancer but also the emotional and psychological well-being of the patient. Then, they should monitor the patient's vital signs and the signs or watch for the signs of infections or complications, especially during after procedures or treatments such as surgery. Nurses should also administer prescribed medications and treatments properly and monitor for possible side effects and adverse reactions. Another important nursing responsibility is to encourage proper nutrition, hydration, and adequate rest. And patient education is also part of the nursing management, wherein nurses teach patients how to perform self-breast examination and follow-up care. Aside from physical care, nurses should also provide emotional support and therapeutic communication with the patient. Nurses should also encourage patients to continue and comply with their treatment plans and follow-up appointments to improve treatment outcomes. And of course, lastly, promote rehabilitation exercises to prevent stiffness and swelling, especially after breast surgery.
Cervical cancer is a disease where abnormal cells develop in the cervix, the lower part of the uterus that connects to the vagina. It usually develops slowly, starting with the precancerous changes called dysplasia. If untreated, these abnormal cells can turn into cancer and spread to nearby tissues. Causes and risk factors of cervical cancer. First, persistent HPV infection is one of the main causes of cervical cancer. It is a long-lasting infection with high-risk HPV types, especially HPV 16 and 18, causes almost all cervical cancers. Second, early sexual activity in multiple partners. It increases exposure to HPV, raising the risk of infection. Next, weakened immune system. Conditions like HIV or immunosuppressive treatments make it harder to fight HPV infections. We also have smoking and secondhand smoke. Damages cells and increases the likelihood of cancer development. Reproductive factors. It is a long-term use of oral contraceptives and having many children are linked to higher risk. Obesity may make screening more difficult, leading to delayed detection. And lastly, we have DES exposure. It is a very rare cause of cervical cancer. Exposure to diethylstilbestrol or DES in the womb increases risk of certain cervical cancers. Symptoms of advanced cervical cancer. There is no often signs or symptoms at first. Cervical cancer is usually silent in early stages, making it hard to detect early. Next, vaginal bleeding after sex. Unusual bleeding following sexual intercourse. Vaginal bleeding after menopause. Any bleeding after menopause is abnormal and should be checked. Bleeding between periods or heavier or longer periods. Changes in normal menstrual patterns. Unusual vaginal discharge. May be watery, foul-smelling, or contain blood. Pelvic pain or pain during sexual intercourse. Discomfort in pelvic area during sex. Next, painful or difficult bowel movements. It indicates possible spread to nearby organs. Second, painful or difficult urination or blood in urine. May suggest urinary tract involvement. Abdominal pain or pain in the stomach area. Swelling of the legs caused by blocked lymphatic or blood flow. Persistent back pain or dull backache. Ongoing lower back discomfort. Feeling tired or fatigue. General weakness or lack of energy. Treatment for cervical cancer. Radiation therapy. It uses high-energy rays, just like X-rays, to kill cancer cells or stop them from growing. It can be given externally, like machine outside the body, or internally, brachytherapy placed near the tumor. It is also used to relieve symptoms and advance cancer. Next, chemotherapy. It uses anti-cancer drugs to destroy cancer cells or stop them from dividing. It may be given alone or combined with other treatments like radiation. Different drug combinations are used depending on the case. Third, we have targeted therapy. It uses drugs that specifically target proteins or substances that help cancer grow. These treatments block cancer cell growth and spread with less damage to normal cells. Examples include drugs like bevacizumab. Fourth, immunotherapy. Helps the immune system recognize and attack cancer cells. It is often used for certain patients based on specific biomarkers. A common drug used is pembrolizumab. Fifth, clinical trials. Research studies that test new cancer treatments or new ways of using existing treatments. Patients may join to access innovative therapies not yet widely available. These trials also help improve future cancer care. Now let's proceed to prevention. HPV vaccination. Vaccination protects against high-risk HPV types, especially HPV 16 and 18, which cause most cervical cancers. It is most effective when given before exposure to HPV, typically before sexual activity. It significantly lowers the risk of developing precancerous cervical changes. Next, avoiding HPV exposure like sexual abstinence. Since HPV is mainly transmitted through sexual contact, avoiding sexual activity prevents infection almost completely. Lower exposure to HPV reduces the overall risk of developing cervical cancer. Now let's proceed to the screenings for cervical cancer. First, pap test or pap smear. The pap test detects abnormal or precancerous cells in the cervix before they turn into cancer. Regular screening has been shown to greatly reduce cervical cancer cases and deaths. Early detection allows treatment before cancer develops. Second, HPV test. This test detects high-risk HPV infections that can lead to cervical cancer. It is more effective in identifying serious cervical changes early and can be used alone or with a pap test. It helps guide early prevention and intervention. Lastly, we have regular screening. Routine screening helps detect cervical changes early, even before symptoms appear. It significantly lowers the risk of dying from cervical cancer by enabling early treatment. However, screening may also have minor risks like false results or unnecessary follow-ups. For the nursing management of cervical cancer, nursing management includes assessing the patient's pain, monitoring for bleeding or infection, and providing comfort measures during treatment such as chemotherapy, radiation, or surgery. Nurses also educate patients about the importance of follow-up care, cervical cancer screening, HPV vaccination, and adherence to prescribed medications and treatments. Emotional support and counseling should be provided to help patients cope with anxiety, fear, and lifestyle changes related to the disease.
So, good morning everyone. Today I will be discussing about ovarian cancer and its causes and risk factors, signs and symptoms, treatment, screening, prevention, and nursing management. Ovarian cancer is a type of cancer that begins in the ovaries. The ovaries are each about the size of an almond. They produce eggs called ova, as well as the hormones estrogen and progesterone. Ovarian cancer is a growth of cells that forms in the ovaries. It happens when cells in the ovaries grow abnormally and uncontrollably. These abnormal cells can form a tumor and may spread to other parts of the body if not treated early. The causes and risk factors of the ovarian cancer. The cause of ovarian cancer is unknown. However, some factors have been shown to affect your chance of developing ovarian cancer. Risk factors that may increase the risk of developing cancer include older age. Ovarian cancer is more common if you are over 50 years old. Women over 50 years old have a high risk of ovarian cancer, especially after menopause, because aging can damage body cells over time. The second one is family history. Some cancers in close relatives, including ovarian cancer, breast cancer, colorectal, and endometrial cancer. This may increase risk because some cancers can be inherited through genes. The third one is having certain faulty genes like BRCA, more common in people of Ashkenazi Jewish ancestry or Lynch syndrome. Inherited gene mutations such as BRCA1 and BRCA2 or Lynch syndrome make it harder for the body to repair damaged cells, increasing the chance of cancer. Next is being overweight because excess body fat can change hormone levels and increase inflammation, which may help cancer develop. And also smoking. Smoking exposes the body to harmful chemicals that damage cells and DNA, raising the risk of ovarian cancer. Next is endometriosis. Endometriosis causes tissue to grow outside the uterus, leading to inflammation that may increase ovarian cancer risk. And lastly, it is also a risk factor if you've never been pregnant, because women who have never been pregnant may ovulate more times during their life, which can slightly increase stress or damage the ovaries. Next is the signs and symptoms of ovarian cancer. First is pelvic or abdominal pain discomfort or bloating, changes in your eating habits, getting full early and losing your appetite. Third one is vaginal discharge or abnormal bleeding, especially if the bleeding occurs outside of your typical menstrual cycle or after you've gone through menopause. Bowel changes such as diarrhea or constipation, an increase in the size of your abdomen, and lastly, peeing more often or frequent urination. These are the treatment for ovarian cancer. First is surgery. This typically involves the removal of your reproductive organs and any organ that has cancer on it. Your surgeon may use laparoscopy, a minimally invasive surgery, or laparotomy, open surgery that requires an abdominal incision. Next is chemotherapy. Your provider may recommend chemotherapy either before or after surgery. Chemotherapy are drugs designed to target and kill cancer cells. Your provider may give you chemotherapy intravenously, through a vein, or orally in pill form. Next is targeted therapy. This cancer treatment uses drugs to identify and attack cancer cells. Targeted therapy changes the way cancer cells grow and divide. Hormone therapy. Some ovarian cancers use hormones to grow. This type of therapy blocks hormones, slowing or stopping the growth of cancer. And lastly, the radiation therapy. Providers rarely use radiation therapy for treatment of ovarian cancer. These are the diagnostic tests for high-risk individuals. First is the transvaginal ultrasound or TVUS. A probe placed in the vagina uses sound waves to create images of the ovaries, identifying solid tumors or fluid-filled cysts. Next is the CA125 blood test. Measures the level of a protein, cancer antigen 125, that is elevated in many but not all women with ovarian cancer. And lastly, the rectovaginal pelvic exam, a physical exam where a doctor checks the ovaries, uterus, and surrounding organs for abnormalities. These are the preventions for ovarian cancer. First is birth control pills. Long-term use lowers risk significantly. Genetic testing, check for BRCA1 and BRCA2 if you have family history. Preventive surgery, removal of ovaries, fallopian tubes for high-risk individuals. Reproductive factors, pregnancy and breastfeeding may reduce risk. And lastly, healthy lifestyle, maintain weight, eat well, and avoid smoking. These are the nursing management for ovarian cancer. First is monitor symptoms, labs, and emotional status, manage pain and chemo side effects, provide pre-post-op care, prevent infection and complications, support nutrition and emotional needs, and lastly, educate on care and follow-ups.
Let's now proceed with cardiovascular and metabolic diseases, which includes heart disease and type 2 diabetes. When we say heart disease, it describes a variety of issues that can affect your heart. Coronary artery disease or CAD is the most common type. CAD can make your arteries narrow and lead to a heart attack. Heart diseases can also affect your heart muscle, valves, or electrical system. The systems you have and the treatments you get depend on the type of heart disease you have. With heart disease, naapektuhan nito ang heart and blood vessels natin. So what are the causes and risk factors? First is the cholesterol. Pag sobrang cholesterol sa katawan, nagkakaroon ng build-up sa loob ng artery which causes it to narrow and block blood flow. This is also one of the reasons ng pagkakaroon ng coronary artery disease. Next is high blood pressure, response to treatment, then menopause. So pag menopause na kasi ang babae, there is a loss of estrogen which removes natural protection. Ang nangyayari dyan, tumataas ang bad cholesterol, blood pressure, and abdominal fat sa katawan. Next is obesity, lack of exercise, smoking, autoimmune diseases, preeclampsia and pregnancy, gestational diabetes, peripartum, and polycystic ovary syndrome or PCOS. One of the most common signs and symptoms of heart disease includes pain or discomfort in the chest o yung pagsakit ng dibdib and unusual fatigue. Then, pain in left breast, back or between their shoulder blades, neck or throat, jaw or teeth, arms, shoulders, and legs. Shortness of breath, feeling dizzy or faint, feeling hot or flushed, indigestion, heart rate, numbness in their hands or fingers, nausea or vomiting, loss of appetite, new vision problems, headache, coughing, and choking sensation. Heart disease treatment in women and in men is similar. It can include medicines, angioplasty and stenting, or coronary artery bypass surgery. Angioplasty is a procedure where a tiny catheter is inserted into an artery. The balloon is then inflated para matanggal kung ano man ang nakablock sa artery. Some differences in heart disease treatment among men and women are: women are less likely to be treated with aspirin and statins to prevent future heart attacks than are men. However, studies show the benefits are similar in both groups. So bakit bihira lang ito gamitin as treatment? It's because mayroong bleeding risk sa aspirin and nakakakos ito ng muscle pain and fatigue. Women are less likely than men to have coronary artery bypass surgery. This may be because women have less obstructive disease or smaller arteries with more small vessel disease. Then cardiac rehabilitation can improve health and delayed recovery from heart disease. However, women are less likely to be sent to cardiac rehabilitation than in men. To prevent heart disease, you have to visit your provider for your yearly physical exams, work with your provider to manage your blood pressure, cholesterol, and blood sugar. This may involve taking medications. Then make an exercise plan that works for you. Slowly work up to 150 minutes per week of moderate to intensity exercise. So pag nag-start pa lang or beginner pa lang, you don't have to force yourself na ibiglain yung sarili mo. Like mag-start ka sa very basic na exercise like walking. Then avoid tobacco products and limit alcohol and follow a heart-healthy eating plan. Nursing management for heart disease includes relieving fluid overload symptoms, relieving symptoms of anxiety and fatigue, promoting physical activity, increasing medication compliance, decreasing adverse effects of treatment, teaching patients about dietary restrictions, then teaching patient about self-monitoring of symptoms, and teaching patients about daily weight monitoring. Let's now proceed with type 2 diabetes. Type 2 diabetes affects how your body uses sugar or glucose for energy. It stops the body from using insulin properly, which can lead to high levels of blood sugar if not treated. Then over time, type 2 diabetes can cause serious damage to the body, especially nerves and blood vessels. So there are two types of diabetes, the type 1 and type 2 diabetes. Sa type 1 diabetes, konti lang or wala talagang insulin na napoproduce ang katawan. Meaning, yung mga may type 1 diabetes, need nila ng insulin injection or pump. You're more likely to develop type 2 diabetes if you have a family history of type 2 diabetes, are older than 45, have overweight or obesity, are physically active less than 3 times a week, had gestational diabetes while pregnant, have high blood pressure or high cholesterol, have prediabetes, and have polycystic ovarian syndrome or PCOS. Because lifestyle is the main cause of type 2 diabetes, the best way to treat this is to keep a healthy lifestyle. Some people with type 2 diabetes will need to take medicines to help manage their blood sugar levels. These can include insulin injections or other medicines. Some examples include metformin, sulfonylureas, sodium glucose cotransporters type 2 inhibitors. To help prevent type 2 diabetes and its complications, people should reach and keep a healthy body weight, stay physically active with at least 150 minutes of moderate exercise each week, eat a healthy diet and avoid sugar and saturated fat, and avoid smoking tobacco. For the nursing management, nurses must recognize the clinical manifestations of altered blood glucose levels in patients and integrate blood glucose monitoring into the plan of care. Nursing management also includes assessing the patient for complications of type 2 diabetes mellitus and providing patient education relating to the plan of care, as well as healthy dietary intake, activity recommendations, and the prescribed medication regimen as needed.
Now, what are the mental health conditions common among women? Or let's say, ano yung nai-experience ng mga babae na nakaka-apekto sa mental health nila? First, we have the sexual partner violence or the intimate partner violence. So, IPV refers to the abuse or aggression that occurs within a romantic relationship. It may involve current or former spouses, partners, or dating relationships. IPV can occur once or repeatedly over time and may vary from mild to severe forms of abuse. So, hindi lang po physical violence or pananakit ang IPV. Pwede rin po itong maging emotional, psychological, sexual, verbal, or controlling behaviors na nakakaapekto sa health, safety, and overall well-being of the individual. So because of this, IPV is considered not only a social issue, but also a serious health concern because it can affect the person physically, emotionally, mentally, and psychologically. Like what I said earlier, hindi lang po pisikal na pananakit ang makikita sa IPV. It is just one of the many types IPV has, and we will be discussing them one by one. First is the physical violence. So this is the use of physical force to hurt or injure a partner. So examples ito is pananampal, pagtulak, pagsipa, and other forms of physical harm. Second is the sexual violence. So this happens when a person forces or attempts to force sexual acts without the partner's consent. In simple terms, ginagawa po ito kahit ayaw or walang permission ng partner. Third is stalking. This refers to repeatedly unwanted contact or behavior that causes fear or concern for safety. Examples nito is yung constant messaging, following someone, monitoring their activities, or threatening behaviors. And lastly, we have the psychological aggression, which includes verbal or nonverbal actions intended to emotionally harm, threaten, or control a partner. Kasama po rito yung insults, yung pananakot, pagpapahiya, or any other behaviors used to manipulate the woman or the partner. Now, for the causes or risk factors of IPV naman, there are several factors that may increase the risk or possibility of violence in relationships. One factor is a history of violence or abuse, especially if a person was exposed to violence before. Next is the alcohol or substance abuse, which can also contribute since this may affect the judgment and behavior of a person. You also have poor anger management, jealousy, and controlling behaviors, which are the most common risk factors kung bakit nagkakaroon ng IPV. We also have financial problems or relationship stress, which may increase conflict within relationships. So other factors is the low self-esteem, the mental health problems, the lack of social support, and the exposure to violence during childhood. Kapag lumaki po kasi yung isang tao sa environment na may violence, there is a possibility na madala niya ito sa future relationships. But this does not justify na mali po yung ginagawa ng partner sa mga babae na nakaka-experience nito. So, ano naman yung common signs of intimate partner violence among women? One possible sign is unexplained injuries, especially if your explanations is inconsistent or hindi klaro. Victims may also appear fearful or has anxiety around a partner. Some women may also experience depression, stress, low self-esteem, or emotional trauma because of the abuse they experience. Others may socially withdraw or isolate themselves from family, friends, or other people. IPV can also affect daily functioning, such as magkaroon sila ng sleep disturbances, eating problems, or poor performance in school or at work because of emotional and psychological stress. Aside from mental and emotional effects, IPV can also lead to physical and reproductive health problems. So overall, yung intimate partner violence does not only affect relationships, but it can also greatly affect a woman's physical, emotional, mental, and social well-being, just like what I have said kanina pa. How can we prevent and raise awareness about IPV? Preventing intimate partner violence requires promoting healthy, respectful, and nonviolent relationships within families and communities. Education and awareness programs can help individuals recognize the abuse or the signs of abuse, understand their rights, and encourage early reporting of violence. Open communication, emotional support, and access to counseling services also plays important roles in preventing abuse and protecting victims. Community involvement, stronger laws, and support systems such as shelters, hotlines, and healthcare services are also essential in addressing IPV. Raising public awareness through seminars, campaigns, and health education can also help reduce the stigma, encourage victims to seek help, and promote safer environments for everyone. Then, here are the nursing management for patients experiencing IPV or intimate partner violence. First, the nurses should assess the patient for possible signs of abuse and injury. It is important to observe both the physical and the emotional condition of the patient. They should also provide a safe and private environment where the patient feels comfortable sharing their experiences. The nurses must use therapeutic and non-judgmental communication to help build trust and support the patient emotionally. Proper documentation of injuries and patient statements is also important for medical and possible legal purposes. The nurses should also treat any injuries and continuously monitor the patient's emotional and psychological condition. If needed, the patients may be referred to counseling services, shelters, hotlines, or legal assistance for additional support and protection. Lastly, nurses should educate patients about safety planning, available resources, and always maintain confidentiality while giving emotional support. These are the bone aging related conditions.
Good day, everyone. Today, let's talk about osteoporosis. According to our slide, this is a condition where the bones become weak and brittle, increasing the risk of fracture. To explain this simple, think of a healthy bone as a strong, solid brick. In osteoporosis, the bone loses its density and starts looking like a fragile sponge. The body is breaking down the old bone faster than it can build a new bone, making it very easy to snap. Now, let's look at why this happens and what signs to watch out for. First, the causes and risk factors. Aging is a major factor for women, and hormonal changes, specifically a decrease in estrogen after a menopause. This is to speed up bone losses. Other causes include a low calcium and a vitamin D intake, a sedentary lifestyle, smoking, alcohol use, and a family history. Next are the signs and symptoms. This disease is often called a silent thief because there are often no symptoms early on. Patients usually don't know why they have it until they experience back pain, loss of height, stoop posture, and frequent fracture in hips, spine, and wrist. Now, let's discuss how we treat and manage this condition. focusing on our vital nursing interventions. So first, for the treatment and management, patients are given calcium and vitamin D supplements to rebuild bone strength. The doctors also prescribe medication like biphosphonates, and as a nurses, a critical safety intervention here is teaching the patient to take this pill first thing in the morning with water and stay completely upright for 30 to 60 minutes to protect their esophagus. For prevention in lifestyle, we encourage patients to eat calcium-rich foods, get regular sun exposure for vitamin D, and avoid smoking and alcohol. And most importantly, our top nursing priority is fall prevention. Because these bones are so fragile, we must keep the patient's environment clutter-free and well lit. We also promote safe, weight-bearing exercises like walking to stimulate the bone growth and manage the pain.
Another bone aging related condition is osteoarthritis. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It happens when the protective cartilage that cushions the ends of the bones wears down over time. Although osteoarthritis can damage any joint, the condition most commonly affects joints in the hands, knees, hips, and spine. Causes and risk factors of osteoarthritis. First, the risk of osteoarthritis increases with age. Second, sex assigned at birth. People assigned female at birth are more likely to develop osteoarthritis, though it isn't clear why. Next, obesity. Carrying extra body weight contributes to osteoarthritis in several ways. The more you weigh, the greater your risk. Increased weight adds stress to weight-bearing joints, such as the hips and knees. Also, fat tissue produces proteins that can cause harmful swelling and around your joints. We also have joint injuries. Injuries such as those that happen when playing sports or from an accident can increase the risk of osteoarthritis. Even injuries that occurred many years ago can increase the risk of it. Repeated stress on the joint. If a job or sport places repetitive stress on a joint, that joint might develop osteoarthritis someday. Genetics. Some people inherit a tendency to develop osteoarthritis. Bone deformities. Some people are born with malformed joints or defective cartilage. And lastly, certain metabolic diseases. These include diabetes and the condition in which your body has too much iron called hemochromatosis. For the treatment and management lifestyle of osteoarthritis, it includes exercises, weight control, physical therapy, and assistive devices to reduce joint stress. Medications such as paracetamol and ibuprofen help relieve pain and inflammation. Severe cases may require corticosteroid injections or joint replacement surgery. For the prevention or lifestyle measures of osteoarthritis, to help prevent osteoarthritis, individuals should maintain proper posture, avoid repetitive joint strain, practice injury prevention, and eat nutritious foods rich in calcium and vitamin D. Staying physically active and avoiding smoking or excessive alcohol intake can also help keep the joints healthy. The nursing management for osteoarthritis includes regular assessment of pain and joint function to monitor progression and treatment effectiveness. The nurse should encourage weight management, proper nutrition, and low-impact exercises such as walking, swimming, and ROM exercises to maintain mobility and strengthen muscles. Heat or cold therapy may be used as ordered to relieve pain and inflammation. while prescribed medications like NSAIDs and analgesics should be given to control pain. The nurse should also assist with mobility aids, promote rest between activities, and teach proper joint protection and body mechanics to prevent further joint damage. In conclusion, understanding women's health is essential in recognizing the common problems and concerns that affect women across different stages of life. Conditions such as reproductive issues, hormonal changes, and other health challenges highlight the importance of early detection, proper management, and continuous health education. As future healthcare providers, it is essential or vital to promote awareness, encourage preventive care, and provide holistic and compassionate interventions. By doing so, we contribute to improving women's overall well-being and empowering them to make informed decisions about their health.